So one of the most common things that I actually saw within my practice, and I actually still get a lot of questions on, are osteoarthritis, joint pain, joint degeneration, both within the knees, the hips, the shoulders. It was a very common condition that came in, and most of the time the patients were coming in because they had tried pretty much every other traditional treatment. They had gone through cortisone injections, they had tried medications, and this is where I discuss what I call the merry-go-round of misery as well when it comes to arthritic type pain or joint pain. It's one of the most common things that happens. Low back pain is another one, but mainly within the joints. I mean, about 90% of Americans suffer from some sort of knee-related issues. It's a lot. And the only solution that traditional medicine actually has at this point right now is drugs to knock out the pain, cortisone shots, and then leading directly to surgery. Sometimes they'll start, but that merry-go-round of misery, how it really starts is what you're doing is you're actually given a medication, which is just going to mask the pain, which means basically if, like, let's say that your car, the brake pads are getting lower and lower and lower, and you just keep going and you think, oh, it's not going to be a big deal. Eventually they're going to be flat and your brakes aren't going to work. That's the same thing. The joint is actually having a grinding effect. That cartilage is actually being worn down. Sometimes that'll crack, and that crack is like a meniscal tear. Well, what do? We go get a pill, which is phase one. If that pill doesn't work, let's try a stronger pill. If that pill doesn't work, then okay, we're going to maybe do a cortisone shot. Cortisone shots, the biggest thing about that, cortisone shots have been around since like 1950s, and it hasn't changed. The doses hasn't changed, and honestly, I don't think the effectiveness has changed. What they've actually recently shown in some amazing research is that a single cortisone injection in the knee within about 6 months actually decreased the space within the knee joint by like 60%. It's pretty phenomenal because what that actually is doing is actually killing the vascularity within a joint space. For anything to heal, we have to have vascularity. It's what gets the nutrients to the supply to that area. And most tissues within joint spaces are avascular or very low in their vascularity. That's why they're white. So the meniscus is white, the ligaments, the tendons are white because there's very little vascularity, which means that they don't heal well. So now if you put a cortisone or any cortisone in there, it's going to just decrease it even more. That's why that space begins to diminish. We go to a cortisone shot. A little bit long of an explanation there, but I want you to understand that because what we found is a resolution to help people with joint issues is going to help to resolve that anti-vascularity issue. The next thing that happens then is if the cortisone shot doesn't work and we have more damage is we go into a scope. So they'll go in and scope the knee or scope the shoulder and they're like, oh, we're going to get all this stuff out. And really what that's doing is just shaving down and diminishing that meniscal layer anyway. So it's not opening up a space, it's still not resolving the root cause of the issue, which is decreased hyaluronic acid and obviously the swelling and inflammation. If that doesn't work, then we're heading to surgery. So there's only a couple tools in the backpacks right now of our traditional medical system. So this merry-go-round of misery keeps happening, and if it's one knee, it's going to end up being the other typically. And sometimes those therapies can work. People get benefit, but my goal is to make sure that they don't have to go through that. So one of the things that we began to utilize within our office, we started with some PRP therapy, which was highly beneficial and worked very well to help to increase the rate of the healing. The next thing that we would go into then is past that is we started using other structural tissues, very robust things like growth factors, cytokines, chemokines, and we would inject those and actually start to restore the joint space, taking those cells and actually opening up the space again, increasing microcirculation and vascularity. And then we would actually come in after that and we began to implement ozone therapy, direct injections into the joint space. Now, what have we learned previously when it comes to ozone therapy? Well, if you haven't watched any other videos, make sure you check them out because they're amazing. But for this specifically, ozone directly in a joint, what it's going to do is actually help to mitigate and balance out the inflammatory response. It also increases microcirculation. And so that microcirculation is essential to help to get restoration to the cartilage, the ligaments, and the areas all in between that joint space. And ozone even has this transdifferentiation effect, meaning it actually goes outside of the joint capsule and it can actually help the soft tissue and the muscles, the ligaments, and the tendons around that joint. And typically we were doing 2, 3, 4, 5 different injections with ozone. And for practitioners, it's extremely beneficial because the cost of ozone is not a lot, but the benefit is astronomically awesome. So you want to make sure that you're using something like that. And then we do combinations of those things. Glucosamine are other great things that you can utilize and take orally for joint space. Vitamin C is incredible because it helps with collagen production as well. And as we've discussed in previous videos, ozone also helps to increase growth factors, collagen factors, by its mechanism of action within the human body. So getting as close to the site as possible, going into that joint space, Ozone has been a phenomenal resource within our clinic and multiple other clinics across the country to help people with osteoarthritis, joint pain, everything from meniscal tears. And we're not saying that we're actually going to reverse all these things. We're just going to actually help to, again, decrease inflammation, help increase mobility, structural tissue issues, and stability is a major thing as well. Yeah, so if you're a patient and you're actually trying to figure out, hey, this sounds really awesome and I would love to get my joints looked at and maybe get an ozone injection, you just want to go in and search through Google search your local area for, a practitioner that utilizes ozone therapy. Now, some practitioners just do intravenous therapy, some do injections, but when you call the office, just ask them if they do direct injections with IV ozone therapy into the joint space or the soft tissue. So if you're a practitioner and you're watching this and you're like, I'd love to have some better understanding and learn some technical skills on how to actually implement Prolo injections directly into your clinic, you can go to mediskill.com. We have advanced training specifically for physicians and practitioners on how to utilize these therapies and modalities.